The focus on intention during the sit was influenced by some work that I was doing through the month of January, and I figured since we're still in January, I would continue with that theme. And also as it pertains to the work of helping others, and just putting it in the context of the Eightfold Path and the Four Noble Truths. And it would seem to me, or my experience has been, that most of the people who enter the helping professions in some way or engage as helpers, the wisdom that they have gathered, the first factor of the path, whether it's formal Dharma wisdom or just the wisdom that tells them that it might be a good idea to get out of self and be of service, be helpful, that wisdom then feeds the intention that is going to lead to the speech, the actions, and for those of us who are working in a field, the livelihood. And then the support available to us through the Eightfold Path, through the Dharma practices, the last three factors, right? Making the effort to sit and developing mindfulness and concentration. And again, it's this preference I have. I guess I don't know any other way, or actually I know the way it was before I found mindfulness practice. I had this one client who always used to say, and I've co-opted this and I feel like I stole it. Well, I kind of stole it from a commercial. She would always talk about her mother being cuckoo for Cocoa Puffs. I was cuckoo for Cocoa Puffs, and I had this innate desire to help people, even before I found any wisdom to back it up. I had a therapist of my own who used to say I suffered from misdirected compassion. That was his diagnosis. Not that there's anyone out there who isn't worthy of receiving it, but that I was kind of like this. If you've ever seen representations of the Bodhisattva of compassion with the multiple arms, I had multiple arms and they were flailing, and I don't think anyone was getting much help out of it. So the setting of intention, and we have a beautiful intention setting ceremony here. I didn't get there this year, but I was there last year. And one of the things that I've noticed about setting intention or New Year's resolutions or however it manifests, is that, I don't know, this is for myself, is that often they last for, a few days, and they kind of drift off. And so what I was helped to think about by being given the role of doing a meditation every week during the month of January and having it be focused on the setting of intention, it really locked me into this feeling of and this idea of that, and this, I know this comes up in the intention setting ceremony, that intention is being set and reset moment to moment. That it's not this thing that I do and then we're good. I mean, there are these larger intentions, like during the meditation, sort of looking at what is my intention for this moment? What is my intention for the next 2 hours? What is my intention for next Thursday? Because next Thursday I have this, that, and the other to do. They're all connected, but they all cycle back to this, in my experience, especially lately, it all cycles back to with my intention for this moment. So there's that. The other thing that I've been thinking about a lot coming up to this gathering was this notion of Buddha as a psychologist. And I remember when I first was told to sit down, shut up, and don't move, It was in a monastery. There were lots of people with robes and shaved heads, and there was a lot of ritual and ceremony, and I loved it. I got into it. There was one monk there who was awesome. He said, I came for the fashion, but I stayed for the silence. And the robes were pretty cool. And it was also Japanese, so it was, the tatami mats and the lines and the tea ceremony. And, anyway, so it was very obviously, it was a monastery. It was a hyper spiritual environment. And when I was introduced to Buddhist practice, I was in the midst of this sort of, I hadn't really thought about spirituality or anything related to it for many, many years. And I was in my sort of search around that. And so that drew me to it. The spiritual side of it drew me to it. It's not true for everybody. But what kept me coming back was what seemed to be happening to my mind and my body and my heart and my ability to stop the arms from flying all over the place and starting to be able to direct my attention and my intention towards usefulness. And in that usefulness, feeling this unreached for payback. One thing that I got in my master's program, to become a therapist, one of the books we were asked to read was about service. And it actually very clear, like the theme of the book, he said, not remembering the title. The theme of the book was that if you're not, as the person serving, if you're not being served, by it in some way, it's actually not service. He didn't say it's therefore codependence or it's, he didn't pathologize it. He was just saying that it's not that we're striving for you to give me something back. It's just that that's what happens when it really is service. And so anyway, this idea of Buddha as psychologist is something that sort of came to me as I practiced at the monastery and then came back into the world, as it were. And in the world, I was compelled to teach other people how to do this. To sit down, shut up, don't move. And the other things associated with it. And I just naturally, and this is before mindfulness was on the cover of Time magazine. And so, but I just sort of naturally, for lack of a better term, removed, a lot of the Buddhist context and taught people to become more mindful. And so I've been teaching and training people to meditate in this way for most of the 25 years, because I saw a group of students, high school students, and they're all, cuckoo for Cocoa Puffs. And I said, this is what I learned. Let's sit down. Here's a practice. And they were like, man, Mr. D, this is awesome. And so for many years, before people were talking about it much, or maybe I just wasn't hearing the talk at the time as an educator, I was working in that way. And then over time, I sort of didn't want to do that anymore. Like I didn't want to take the Buddhist context out. And that's a lot of, it started before I started hanging out with Noah, but, I'm now at this place where I just adore the Dharma. I just love the Dharma. The Buddha Dharma. And part of what I adore about it is that he was like the best psychologist ever. He nailed it. 2,600 years. Like he nailed it. And again, my being a Zen student for many years, I studied 0 suttas for years. I sat and I sat and I sat and I sat. And I sat with koans and I sat with breath. And that's what I did. So there's a lot about the suttas that I didn't know. I didn't really know a lot of the words of the Buddha. And having spent some time with them over the last few years, one thing that I noticed, well, I knew this from before, but, whenever someone would ask Buddha, are you God? Because, if it's 2,600 years ago and this guy obviously figured something out that no one else was able to figure out, it must be God, right? So are you God? No. Are you some kind of heavenly being? Other type of heavenly being? No. Well, what are you? I am awake. Right? And then what did he awaken to, or what did he say he was awakened to? He was awakened to the direct experience of Buddha nature, or Buddhahood, or the true nature of things. So I'm a person, he said. I'm a person who had this direct experience, and at first, when faced with the task of teaching it, his first response or his first thought was like, I can't even explain. There's no way I can explain this. Got nothing. And then was encouraged to just try. And so, I think there was a formulation before the Four Noble Truths. Like he had a version and it kind of didn't land. And then the Four Noble Truths are built on or built with the medicine of the time, Ayurvedic medicine. Right? It's like a laying out of the diagnosis, the symptoms, the prognosis, the prescription. And so he was a psychologist. He was a doctor. And I like the incense and the fashion and the and sort of the more spiritual aspects of practice. Another thing that I've noticed in looking at, and this is something that I love, two things related. Those of you who know me, that I can still geek out a little bit about 12-step stuff, in as much as I was in Ohio 2 weekends ago, and I took a red eye, and I got there super early in the morning, and the hotel that I was staying at, I took the nicer hotel, and so it was sold out, and so they couldn't get me into my room early, so I'm stuck in Cleveland Airport at like 6:30 in the morning without a room until 2 in the afternoon. So I'm like, wow, this is a big suck. So, but then I thought, all right, well, let's drive and we'll find a Starbucks or whatever, get some work done. I start driving, and then there's the sign, Akron, this way, birthplace of AA. So I just was like, I'm tired, I'm a little loopy, here we go. We're going to Dr. Bob's house. And I didn't even call to see if he was awake. I just went. And so I got to stalk the outside of the house, because it's a little museum, and it's open from noon until 4 for those of you interested next time you're in Akron. And so I just kind of hung out outside his house. And by the way, the house across the street is for sale if you really want to be like across the street from where it all went down. Anyway, so I sat there for a while, and then I looked it up, and I did the GPS thing, and I saw like all the other hot spots. And I had a few hours. So first I went to I can't remember the order chronologically, but I went to the Mayflower Hotel where Bill Wilson made that phone call, and then I went to Dr. Bob's grave, and then I went to the gatehouse of the Sieberling Mansion, where Henrietta Sieberling set Bill and Bob up to have their initial conversation. That was the best part. I felt some energy there. And so, point being that, number one, Dr. Bob was always my favorite. And the second part is that a friend of ours, Regina Walker, she's in the Sangha in New York, she found a pamphlet from the early Akron group. Some of you might have heard me talk about this. It's from the Akron group, and it's from like the late 1930s or early 40s, and it's edited by Dr. Bob, and it says something to the effect of, we have looked at all the spiritual traditions of the history of man. That's probably the way they said it, right? 1940s Akron. And we have discovered that the one that closely resembles our 12 steps is the Four Noble Truths and the Eightfold Path of the Buddha. Bam! So anyway, I was feeling that energy, and I was feeling that was something that, at least, I don't need that to back me up. My intuition is my intuition, or my feeling is my feeling. But that's always been my feeling about it, right? Is that the Four Noble Truths and the Eightfold Path is this spiritual path designed by this, amazing psychologist. And so, another thing that, of course, when people found out, or Buddha said that he wasn't God, a lot of people were, well, then, is there a God? Can you tell, every metaphysical question you could imagine, every stoner, every guy on acid came up to him and said, dude, is there a God? And his answer fairly consistently was, I don't know if he said, I don't know, but he said something to the effect of, it's not important. Like, how does that help us to end suffering? I teach suffering and the end of suffering. And I always thought of that in the context of, like, oh, wow, this is the Four Noble Truths, the Eightfold Path of the Buddha, and it's a spiritual path, and I knocked into it, and now I'm a Dharma practitioner, and aren't I lucky? But now, in this context, I'm thinking of it as wow, suffering and the end of suffering. As an educator, as a therapist, as a friend, as a caregiver to an aging parent, as a caregiver to a person who's unwell and not of that age, as a tech at a rehab, as a counselor, as a yoga teacher, as all of these manifestations of, I am walking on this earth and I feel compelled through compassion and loving kindness and even appreciative joy and equanimity. I am compelled to be of help, to be of service. That's amazing to me. And then I kind of cycle back to the suffering part and see my own suffering, get some insight into my own suffering around the fact that I can't end all suffering. Or my suffering around the way sometimes, let's say, that you won't end suffering for yourself the way that I can see it right from here, but you're not going to do X, Y, and Z because you're not going to do it, and the suffering that can come from that. As opposed to being able to step back. Okay, suffering. It's caused by craving. All right, I'm craving you to do what I think you should do. Maybe I should work on that. And then from that place, maybe I can help you with your craving and your attachment. And so it's kind of this dance. It's a dance and a process, and it's also embedded in there is the interconnectedness, right? That, as a therapist, as a human being, I'm sitting around hanging out with a bunch of mirrors. So one of the wonderful opportunities that I've had, and that I'm going to continue to have, God willing and the creek don't rise, is I've become the basic trainer in EMDR therapy, for anyone who's familiar with that. It's a trauma therapy, if you're not familiar with that, and I've been engaged with it for like 10 years at this point. And so the first job that I took, as it were, was to train all the clinicians at Refuge Recovery. And we're halfway through. We've done the part 1 training. And part of that training it's sort of like taking everything I just said to the next level. It's that next level of, what can I do or what will I do in the presence of intense suffering? Can I sit with that? Can I handle that? Can I stay with it long enough to allow for that person to process their way through and thereby end suffering? So my hope, my encouragement, my sincere desire for the continued work upon this in this way is that as many people as possible are able to access this unbelievably powerful knowledge of the 2,600 years old psychologist, in order so that I can sit with the intense suffering of others. If I can sit with the intense suffering of others, I can sit with, the annoyance of others, right? If you can do the hardcore shit, you pedal backwards, and you can do the easier stuff. Although I've heard say, and I've experienced too, that sometimes people with addiction have that backwards. I know that I did. Did you ever hear that one about the difference between an alcoholic and a person who's not an alcoholic? A normal person, their car breaks down, they call AAA. Alcoholic, their car breaks down, they call suicide prevention. So how do I utilize this knowledge to be able to stay in a place of loving kindness, compassion, that is balanced, or kind of the intensity of that is sort of balanced by equanimity, the ability to sit through, be mindful of, moment to moment, set and reset the intention to be there for the other in a way that is respectful of us both. So that's my sincere desire. And my sincere gratitude is for the Dharma and everyone here, part of this Sangha that exists, in particular from 10 a.m. till 1 p.m., and towards everyone else in the greater Sangha.